is Dr. Lucie Bianchi, and we are at the Mindful Medi-Spa and Medi-Clinic. And today I have with me my new friend, Dr. Dan Briggs, and he is a new partner at Core Orthopedics. If you're not familiar with Core Orthopedics, they have two locations, one in Hoffman Estates, which is right in our back door, and the other in Elk Grove Village. And there's 5 main orthopedics there. You want to let me know who your partners are?
Absolutely. So I have Dr. Cusis, he's a hip and knee specialist. Dr. Drake covers shoulder and elbow. Dr. Murray does sports medicine. And Dr. Metz is a hand specialist.
Okay, so it sounds like you pretty much have the entire body covered between all of you. And then besides having the specialists in those individual areas, do you also have physical therapy services?
We do. Both our office locations in Hoffman Estates and Elk Grove both have physical therapy, so we have that covered as well.
Oh, isn't that convenient? One-stop shopping. I love that. Kind of just like Mindful. You can get everything done in one area, so you don't have to keep driving around in that Chicago traffic. Now, Dr. Briggs is very well educated. He started out at Syracuse University, which is very difficult to get into for anyone outside of New York. That is considered a really, really good school. And he also did a medical school in New York and Buffalo. Did his, residency at Michigan Beaumont, and did his fellowship, which has him specialize in ankle and foot, at Northwestern University, so right here in our backyard. And Core is the first place that you've started to work, correct?
Correct.
All right, and how are things going at Core?
Great.
All right, and then what drew you to ankle and foot?
So I like that there's a lot of variety in terms of the surgeries that get done. There's tons and tons of different pathologies, so problems that people have, which means there's a lot of things to think about. It's kind of a cerebral specialty, and I like to think, so that's really what it was. Also, my mentors in residency in foot and ankle were very good. One of the best surgeons that I worked with as a resident was foot and ankle, and he was really inspiring, so that was a lot of it as well.
Oh, okay, well that's great, that's great. So you yourself haven't had lots of ankle injuries or limp or have a false limb or anything like that?
Thankfully, that is not how I was drawn to the field. Many people are brought in that way, but for me it was more watching other people's experiences.
Sure, sure. Excellent. Alrighty, so I thought today we might talk about something that interests, a lot of my members and really people at large, which is ankle injuries, and I figured you might be the best expert for that.
Happy to talk about it. It's something we see all the time, for sure.
So when you see ankle injuries, what would you say the most common ankle injury is?
So I think the most common thing that I see is just a normal, straightforward ankle sprain. So there's lots of different types of ankle sprains, but most commonly one of the ligaments, the ATFL, is what's affected. And what tends to happen is someone's walking along, they roll their ankle inward, and that ligament stretches and actually can tear, and that person ends up with an ankle sprain. So they know that they have pain, a little trouble walking, sometimes have a lot of swelling, and that's generally how it kind of first comes about. Presents.
Okay, all right. And I've seen that happen with platform shoes, flip-flops.
Absolutely.
What are the other ways you see it?
So sporting injuries a lot of the time, just missing a step, tripping down a stair, all very common ways. Any kind of unstable shoe can have that happen.
What is the average length of time from injury to feeling back to normal?
So minimum, it's usually 6 weeks, which is that's on the quicker end. Could be 3 months on the slower end, and that's if everything goes well and people respond to the non-operative treatment, which is about 85% of people. So about 4 out of 5 people do great without surgery, just the non-operative measures, but usually 6 to 12 weeks.
So if someone sprains their ankle on a step or on a sporting event, what would you advise them for initial care? What's the first thing they should do, or the first couple things?
So first thing, it's always good to see somebody who's used to treating these injuries, because you don't want to miss it, because if you don't treat it, then you're more apt to develop chronic instability and have issues, and more likely to need surgery down the road than if you treat it right away. So step one is just having your ankle evaluated, because sometimes it's hard to know if it's really an ankle sprain. Some people have very high pain tolerance, can have a fractured ankle and be walking around on it, and you don't want to miss that. So it's important to come get it checked out.
And you have x-ray facilities at your core, correct?
Absolutely.
So you can find that out at core right away if you're broken or sprained. I didn't mean to cut you off there.
That's okay. Absolutely. Next step after that is determining whether you need to go into a brace or a boot. Sometimes people are too swollen to just put in an ankle brace right away. If that's the case, usually I put them in an ankle boot for about 2 weeks. If they're having a ton of pain when they come back after the boot, then sometimes may consider an MRI at that point, but that's pretty rare. Usually, once you've walked around in the boot for a couple weeks, at that point, then you can transition to an ankle brace. When you transition to the ankle brace, usually start physical therapy to work on proprioception, which just means a fancy word for balance, which is a very important part of the rehab, and also range of motioning and strengthening of the ankle.
So the important point maybe for people watching is that physical therapy maybe isn't something we should be aggressive with until all of the swelling is gone?
Not all the swelling, but you need to be able to walk around a little bit and tolerate being able to walk around at least in a brace before you start physical therapy. If you're not so swollen that you need a boot, if you can go into a brace right away, then it's okay to start physical therapy. So you can be a little bit more aggressive in most people, but some people are very swollen and just have a hard time going into a brace initially.
Okay. What would you advise to preteens and teenagers who are playing sports that are high risk for ankle injuries?
So I think it's important to be vigilant in just recognizing when you have an injury. The old school philosophy was play through the pain, and I think there's really been a lot of change in mindset in a lot of sport in the sports world, both in sports medicine, but also I think coaches and athletic trainers are kind of more in tune with that's not always the right answer. So I think initially just being mindful that you had the injury, giving it some time so that you're not necessarily immediately right out on the field pounding on the ankle, because that's only going to make your recovery longer. I know we talked before the show about taping. So preemptive taping is fine if you have an athletic trainer, if you have that is comfortable with that, if you have a history of somebody who maybe has some ankle instability. I think that's totally fine. But if you haven't had any ankle pathology, ankle sprain, anything like that, you don't necessarily need to pre-tape or anything. Mostly it's just about good conditioning, conditioning in terms of strengthening the ankle along with whatever your strength regimen is for the rest of the sport. Can be helpful for sure.
At what age do you think that weight training or weightlifting would be appropriate for a kid?
I think the thinking on that now is that there's not really an age that's too young. It should be reasonable. So you don't necessarily want to be trying to bench 300 pounds if you're an 8-year-old kid. But strength training is good at any age. It just has to be appropriate. You don't necessarily need to be doing heavy weights as a youngster, but I think some strength training in terms of body exercise, plyometrics, and body weight exercises, so push-ups, things like that, are totally appropriate. But I think it's helpful to have the guidance of a coach or an athletic trainer if you are doing sports like through a soccer program or a basketball program or whatever that may be. I think it's helpful to have some guidance from somebody with experience.
Yeah, I think so. I think that more is better, but if you lift too much weight too often, you can cause a lot of injuries to growth plates and whatnot.
Absolutely, right? You don't want to overdo it. And I think that there is a culture of strength means lifting as much weight as possible, which is that's not the goal. The goal is to have proper form and to functionally strengthen so that you're going to be able to do whatever that sport is better than you could before.
Right, sure. So maybe it's better to work on your endurance and be able to easily lift a weight and then stop lifting a weight when you're fatigued versus like, oh my gosh, I'm pretty sure I can lift this.
Absolutely.
So what would you say for an adult that has had recurrent ankle sprains, has periods of time where they're well, But each time they have an ankle sprain, it takes longer and longer for that recovery to come back to them.
So this is the kind of case where you start to think that surgery may be indicated. It's a little bit of a gray area because it does depend on how often they're rolling their ankle, the recovery, like you said, as it becomes more often, as the recovery becomes more prolonged, then you start to worry a little bit that they may need something done. So then at that point, usually they've done, physical therapy, hasn't gotten better, or they've done it a couple, different times. They've had ankle sprains, physical therapy, but then have a recurrent ankle sprain. That's when you really start to think about ordering an MRI to get a good look. And so that way you know what's going on, you can come up with a surgical plan, because if you constantly are spraining your ankle, it's one of the rare instances where you actually are at risk of developing ankle arthritis. Ankle arthritis is not as common as what you see in the knee and the hip, because it tends to be mostly due to trauma. So that trauma can either be a bad fracture, but it can also be recurrent ankle sprain. So it's important to get that checked out, because if you let that go, you can develop arthritis.
And arthritis is no fun. I have many old patients who will, admit to that. All right. Well, why don't we shift gears from ankle injuries and talk about something else that we see commonly here at Mindful, which is injuries to the Achilles tendon. Now, what are the most common things you see when someone injures an Achilles?
So there's usually kind of two sets. There's the acute injury where you actually have a complete rupture, and then there's injury that's more like a tendon strain, so like a tendonitis type of thing. So the rupture tends to be usually traumatic. Somebody is walking, and then all of a sudden they have a step in a hole, and the Achilles is basically elongated very quickly, and in an effort to resist that elongation, you fire the Achilles as you're lengthening it, and you get a tear in the Achilles. So that is important to diagnose as quickly as possible. So depending on the patient, that can either be treated operatively or non-operatively. Any younger patients that are more athletic, we tend to be more aggressive about operating on them right away.
So they get back to activity?
Exactly. So part of it is getting back to activity, but part of it is strength. So the literature on Achilles tendon ruptures is a little bit all over the place in terms of whether it's better to fix them or not fix them. There's some literature that suggests that non-opping them, patients that do not have surgery do very well. However, they do seem to lose a little bit of strength. But if you're somebody who maybe is not running, pounding, jumping on their Achilles all day, it may be more beneficial to you to go non-operative and avoid the risk of surgery. However, if you're younger, that
no one likes to wait, because how long would you generally have to wait for it to heal on its own?
It takes a long time, so usually at least 6 months. Surgery does not necessarily speed that recovery, but it does give you more strength.
Okay. And then I think more of the ruptures that I've seen have been with grown-ups. And people who have not been regularly exercising, going to do something that they used to do all of the time, no problem, and then all of a sudden there's a problem. But have you seen a number of younger folks with it?
You see it. It is more common in what we call the weekend warrior, like you say, maybe not every day going out and pounding on it, but likes to go out, play basketball on the weekend, and that's one of the most common ways is somebody goes up, takes a shot, and comes down, and as they're landing on their Achilles, they feel a pop, and that's the end of it.
Yes, the younger population that we see is less rupture, more like tendonitis sort of things, or like even a traumatic tendonitis is what I see. So what could younger people do to prevent that? Stretching
is super important. So calf stretches are very important. There's also strengthening, but what we call eccentric strengthening, which is the Achilles helps to basically power off the ankle so that you can, jump, go up on your toes. Eccentric strengthening is when the Achilles is actually lengthening, so it's stretching. So as you come down off your toes, the Achilles is getting longer, but it's also working to make sure that you're not going down too fast. So strengthening in that direction tends to be very helpful for tendonitis and those type of issues. And that's something often that is very helpful to go over with a physical therapist or an athletic trainer, somebody who's got some experience with that, because it can be a little tricky trying to do that on your own.
Right, with stretching and such. But always, ice is our best friend, correct?
Yes, an acute injury for sure helps with inflammation. If you can take non-steroidal anti-inflammatories like Motrin, they can be very helpful as well. Most kids can, but obviously some adults have medical issues that kind of preclude that.
So there's tons and tons of adults that can't take that. Even there's even adults that think they can take those medications who cannot. So it's always good to ask your primary about medications because they can interact and you may have medical issues that are not going to work. And ice is the safest anti-inflammatory there is, really. Now, what do you think about people walking around without shoes in their house? Do you think that's a good idea?
It oftentimes can, if you are predisposed to something like this, can aggravate these issues for sure. Some people will be just fine without shoes, but if you are having any of these issues, most likely you're better off with some support. Usually like an athletic shoe, it can be very helpful.
Okay, now what about supplements? Are there any supplements, minerals, vitamins, anything that someone could take to either prevent an injury like this or make their ankle and knee areas like stronger, in your opinion?
There are not any supplements that I particularly recommend, but that's a field that don't have a ton of expertise in. So I don't feel strongly about supplements. One thing I will say about supplements is I do recommend vitamin D supplement, especially up here in north climate where there's not a lot of sunlight.
Right? Yes.
That can be very helpful because it turns out a lot of patients that I see with certain types of foot pain and stress fractures and things like that oftentimes have low vitamin D, and I think that supplementing that can be very helpful.
Right, so pretty much everybody needs to take vitamin D, at least 1,000 international units, but most people actually do need 2,000 international units per day. So easy to take that there's no reason not to take it. It comes in liquid, capsules, tablets, a lot of different forms. It's hard to get it in the diet.
It is, it
Very
really
hard.
is.
I have a really good friend who works in Denver, and they have a lot of vitamin D deficiency issues despite the fact that they have 300 days of sun because everybody's wearing sunscreen and big floppy hats and trying not to get skin cancer. So it's definitely a bigger problem than north, but really a problem everywhere because we're combating two different issues which kind of conflict one another. What about shoes? Women's shoes in particular. Like, should women not wear stilettos? Should women not wear heels?
I tell all my patients they should avoid heels like the plague, but I understand, there's social obligations, there's culture, so sometimes that is very difficult, but they do predispose you to ankle injuries because, of course, if your ankle's high off the ground, it's very easy to roll your ankle. The other thing that they often are part of the root cause of is bunions. Oftentimes are kind of caused, we think, by that tight toe box when it just jams.
Squished.
Exactly.
Oh goodness. So how many hours can a woman wear a heel before she's ruined her feet?
Ooh, there's no set answer. As little as possible is my general recommendation, but nobody knows the answer to that question.
Does your wife wear heels?
She does not, but she also has rheumatoid arthritis, so she's not so much into the heel wearing phase anymore.
She's a good patient. Oh goodness.
She can't fit that foot into a heel anymore. Hopefully she doesn't mind me saying that, but
well, I'm sure no one can pick her out of a crowd unless they're interested in ankle injuries. So would you mind coming back and maybe talking to our patients when we're able to open up a little bit, live?
Of course.
I have a lot of patients who have chronic ankle issues, sometimes acute ankle issues, and knowing that line of when you're supposed to see the specialist can be a little fuzzy, and of course I can help you with that. But one of the things we like to do here at Mindful is educate the community, and sometimes that education can be done even better when we're in person. So thank you so much for coming today. I hope this was helpful for everybody in some of the common ankle and Achilles tendon injuries, and hopefully you ladies out there will limit your high heel use to absolutely necessary and throw away your supplements. Well, no, don't throw away your supplements. Just take D if we're worried about orthopedic prevention stuff. Bye-bye. Have a good day.
thank you.